Welcome to the experiences of workers who do not successfully return to work following a work-related injury. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. Today's webinar will be co-moderated by Maureen Han, President and CEO of the Canadian Council on Rehabilitation and Work. The Canadian Council on Rehabilitation and Work focuses on supporting job seekers with disabilities and employers across Canada. Maureen will be running our Q&A session, and I will let her introduce our guest speaker, Dr. Rebecca Gewurtz.
Thank you so much, Yusra. That was excellent. It's my absolute pleasure to be co-hosting this webinar today, and it's my pleasure to introduce Dr. Rebecca Gewurtz. Rebecca is an occupational therapist and associate professor in the School of Rehabilitation Science at McMaster University. Her research is focused on work disability policy, income security, employment supports among people living with mental illness and other episodic disabilities in Canada. She uses primarily qualitative methods in her research, but has collaborated on projects using quantitative and mixed method approaches to examine experiences of people living with disabilities in Canada as they seek and retain employment or apply for income replacement benefits. It's my pleasure to turn the mic over to you, Rebecca, who, by the way, everybody, I consider a dear friend and has been instrumental in a lot of the work that CCRW has done over the years. I'm looking forward to your presentation, Rebecca. Thank you.
Thank you so much. I hope everyone can hear me, and it's my pleasure as well to be here today. And today I'm going to be talking about the work that I've been doing in this area, and we've been doing this work for a while. So the actual research that I'm going to share with you today was completed a couple years ago, and I'm going to also tell you sort of what's been going on since that time, and keep you informed, because this line of inquiry is actually quite important and ongoing. Okay, so the work, this project is entitled The Experiences of Injured Workers Who Do Not Successfully Return to Work. And it was done, this project was done through funding from the Center for Research on Work Disability Policy. And if you're not familiar with this center, it's probably something you want to look up. It has an excellent website that has lots of information, and it's a SSHRC-funded center that is actually going into its 7th year of operation, and has accomplished quite a bit in the last 6 years. So certainly a website that you'd want to look up. And through funding from the center, from the CRWDP, myself and my colleague Stephanie Prengi, who's in the School of Labor Studies at McMaster University, and Lynn Holness, who's an occupational health and safety physician at St. Michael's Hospital in Toronto, completed this study along with support from a few graduate students who helped with the data collection and analysis. So as background, a minority of injured workers do not successfully return to work after work-related injury. Now, this research was completed in Ontario. However, we know this is an issue across all Canadian provinces, that the majority of injured workers have a fairly straightforward return to work. They have a workplace injury, they might get some benefits, they might have some time off work, and then they return to work. And different statistics have been put out there about how many follow that sort of straightforward trajectory, and we know that happens for the majority of workers. However, there is an important group of injured workers who do not follow that trajectory, and very, very little has been done examining sort of what's happening with that group of people. We know that among that group of people, there's complex barriers to return to work. And often these are workers who face multiple vulnerabilities. And what I mean by vulnerabilities here is that they tend to be individuals who, prior to their injury, you know, English might be a second language, they might be new to Canada, they might already have a disability pre-injury. So all kinds of things might be working together to create sort of complex situation that seems to interfere with that return to work. So we really wanted to examine this issue and understand what happens to injured workers who are not returning to work as expected. So our research question was just that. We wanted to explore what happens to workers who do not successfully reintegrate the workplace following a workplace injury. And here I would say it was specifically injured workers who might have been expected to return to work and didn't. So that was the group we were really interested in. And our objectives were to explore their experiences, including the social, economic, and emotional impacts on the injured workers themselves, as well as their families. We wanted to understand how these experiences were shaped by their interactions with disability benefit systems, and also how they were shaped by their physical, mental, and social vulnerabilities. And we used an interpretive qualitative approach, and we interviewed injured workers who had challenging return to work trajectories, as well as service providers who support injured workers who have these challenging return to work trajectories. So we used a process of maximal variation. What that really means is we wanted to speak to people who had different experiences, and we wanted to capture these different experiences. And so it was a small study. We spoke to 11 participants who had experienced workplace injuries and not returned to work as expected. And we spoke to 4 service providers, and these service providers included people who worked for employers, so they might have been return to work HR managers or health and safety managers in a workplace. We spoke to healthcare providers, union representatives, as well as legal representatives. So in the legal realm, we actually partnered with legal aid clinics who supported our recruitment and also shared their perspective. So our recruitment was done through community partners, and because we were really focused on capturing the experiences of people who had vulnerabilities, including linguistic minorities. We did have translation available for those who didn't speak English. So recruitment wasn't limited to English-speaking participants. So I know we had a small sample size, and I'm going to talk a lot about next steps at the end of the presentation, because that is something, obviously there's a need to scale this up and look at this issue more broadly. And so I would position this as a preliminary investigation, a bit of a pilot study, and identifying issues that we needed to consider. However, just to give you some background about who participated and who we spoke to, the injured workers tended to be older. The average age was 51 years. There was a fairly equal split between males and females. The types of job at the time of the injury varied from factory. The majority of participants were in a factory setting, but we did have people from the trades, health services, and service sector. At the time of the interview, 3 participants were employed part-time, and the others were unemployed. And this is another issue that's important for us to recognize, is the time since injury. We spoke, there was a huge variation, and we spoke to people who it had been 15 months since their injury, and also people who had been injured 28 years ago. So what that tells us is that workers' compensation policy has changed a lot in 28 years. So in many cases, we need to keep that in mind as we go through the analysis. The majority of people have been injured within the last 5-6 years, but I'll address that issue as I go. There was variation in the types of injury. We didn't limit in any way about the type of workplace injury people sustained. So it varied from musculoskeletal to vascular type injuries. The status on workers' compensation is also very important. You can see here that for one participant, they had received benefits and it ended. But for the majority of participants, they were either receiving partial benefits of some kind. There was 4 participants who were in the process of an appeal, and 2 participants who had never received any benefits. And their source of income at the time of the interview included WSIB, but also some part-time work. And what's really significant here is that 3 participants stated that they had no income at the time of the interview. So I'm going to get into the findings. I'll talk a little bit about the limitations of the study and what we want to do next with this line of inquiry, because I think that's very important. Overall, we documented a trajectory that throughout the trajectory, one of the key things that emerged was this sense of emotional distress following the injury, and that was prevalent across all the interviews. What's interesting here is that before the injury, although I would say that many of our participants had pre-existing vulnerabilities, they described their pre-injury employment as fairly high, unremarkable. They were quite satisfied in their work, and they enjoyed working, and they were pretty committed to the job that they were doing. At the time of the injury, what was significant here was that there was typically, for many of the participants, a delay in reporting the injury. And a process for how they sort of navigated how to report the injury. So that was significant for some of the participants. And then WSIB became involved, and there was quite a bit of concern about how the injury was categorized, and I'll get into that with the findings. So how WSIB sort of interpreted and understood the injury. And I'm going to make it clear here that, again, this is an Ontario study. So WSIB is our workers' compensation board in Ontario. I think some of these findings do have application across Canada, so I'll talk about that as well. But for now, we're going to talk really about WSIB. So the Workplace Safety and Insurance Board here in Ontario. And then there was a work reintegration process, which was described generally as quite rigid and oftentimes inconsistent with the skills that the workers brought and their interests and competencies. And then overall, there was a sense of uncertainty about the future in terms of financial instability and the impact on family and stigma, as well as ongoing health concerns. So I'll get into the findings now. there was a strong prevalence of describing financial strain. Many of the participants talked about how difficult it was that when benefits were discontinued, and they weren't really sure what to do in those circumstances. They described really no follow-up and no sense of what to do next, and really also described how difficult this was on them and how it really impacted them emotionally and physically, and it really aggravated the injuries that they sustained and wasn't really conducive to their recovery. So it really interfered with their ability to recover. So I'll give you a quote here. This is one example from one participant who was 2 years post-injury and 55 years old. And she was one of the participants who was not currently receiving any income. So she describes, 5 months, I'm without a cent of income. Nobody knows if I'm, just boiling water and drinking it. You don't go out and tell people this is how you're going to live in your house, and at the same time they expect you to get healthier, to emotionally be better, to physically be better. On what? If you're only eating carbs all the time, how can you get healthy? So this quote really illustrates how the financial strain impacts people's health and their capacity to work on their recovery. And then we also asked about the impact on people's family and their relationships with their family. And all of the participants described an impact on their family. In many cases, participants noted that their families were were very supportive and were really helping in their recovery and holding things together for them. However, they also all described their altered role within the family and how their position within the family has changed now that they were no longer working. They also described resentment and how these tensions were amplified by the financial strain. And some participants had really complex family situations. Some individuals that were part of our sample were new to Canada and were in Canada working and had been sending money back to their countries, and so it was very difficult, and they often had plans to bring their families over, and so in many ways suddenly they were going from the person who was providing to the person who was now in need of help and really struggling to explain that. This is Emma again describing how her responsibility taking care of her kids was impacted by her workplace injury and also not having money to take care of her kids, and how was she going to manage that? So what was also interesting in the data we collected is that many participants described subsequent health concerns. So following their workplace injury, they described ongoing mental health concerns, chronic pain, and pretty intense emotional distress. And they linked these health concerns to some of their experiences, including pressure to return to work to have a quick return to work, and that return to work being unsuccessful, and how demoralizing that experience was. When they did return to work, feeling or describing inadequate accommodations in the workplace, and therefore experiencing ongoing pain and leading to subsequent re-injury. And then they also described, and we got taste of that with Emma's quotes, but the impact that their interactions with the Workers' Compensation Board had on them, and the subsequent health concerns that seem to come from that. So that's how they made those links. So here's some quotes about sort of the subsequent health concerns that were described by participants. Daniel, who was 38 years old, described, said, it's hard when you're still trying to navigate the system and still finding barriers after 7 or almost 8 years. So the impact of that ongoing navigation and really fighting the system had an impact. And then one of the service providers noted, it's incredibly frustrating, anxiety provoking. It delegitimizes them, and there's a dignity and respect issue that has very real consequences. So this is a legal worker. The next concept that emerged from the findings was negative employment experiences and outcomes. And I've alluded to this already in describing the impact that an unsuccessful return to work can have on individuals. Certainly the participants described pressure to return to work. What was very interesting is participants describing how the requirements from the Workers' Compensation Board would sometimes conflict with the recommendations from their trusted healthcare providers. That issue has since been written in a report here in Ontario about how often that does happen. Certainly that came out in our findings, that participants would describe that their family doctor, their physician or physiotherapist would tell them that they had to rest or do certain things to support their recovery, and then you know, their requirements from the Workers' Compensation Board wouldn't align with that, and they were sort of torn on what to do because they wanted to keep their benefits, but they also wanted to work towards their recovery. The third bullet here is also very interesting. Participants described challenges with rigid injury categorization. And what is meant here is that the Workers' Compensation Board, when you have an injury, will see that injury and sort of say, okay, well, with a broken leg, you typically, you know, need X number of weeks to recover, and then you can go back to work. And there's sort of a trajectory of recovery for typical injuries. What isn't accounted for when you have these categorizations is complex situations. And I'll give you an example of that. But basically, one of the participants described how he broke his leg, and that break led to vascular issues. He wouldn't have experienced that vascular injury had he not broken his leg, but the workplace injury was the broken leg and not the vascular issues, which were subsequently preventing him from returning to work. And so as a result, some people were in this state of limbo with work, where they were supposed to be returning to work and they couldn't return to work, and there was a lot of uncertainty around that. Some people returned to work only to be terminated, and other people were not able to return to their pre-accident employer, and then were subsequently found other jobs that were not really well matched to their skills and abilities, and often they were put into sectors that really represented a deskilling of their qualifications. And I'll give you some examples of this, because this last bullet point starts to get into some of the challenges of foreign trained professionals. So this first one is in terms of categorizing injuries, and I alluded to this example, but they've lumped me into the broken leg category, where somebody breaks their leg and is off for 6 months, then you go back to work. That's what WSIB assumes I should be able to do, because there's no category for vascular injuries or blood clots or deteriorated veins or anything. There's no classification for that. So they just put you in a certain category and expect you're going to have the same results as everybody else. So many of the participants that had these complex return to work processes were individuals who their initial workplace injury led to subsequent complications, and that's what made it sort of difficult. And then this issue of deskilling, this participant was somebody who was a internationally trained, or was trained as a healthcare professional outside of Canada, and then came to Canada and was working as, I believe, a PSW, and then was injured. And because of the way WSIB worked, when she couldn't return to her pre-accident, her accident employer, she was put towards housekeeping and laundry services, which might be equivalent in terms of pay to a PSW, but it wasn't the same meaning, and so there was an important loss for this individual. And then the other area that came out in the findings was this issue of stigma. And there was a lot of stigma described by participants that pervaded their interactions with coworkers, employers, supervisors, and the workers' compensation staff. And then in addition to that, these were typically individuals whose injuries were now sort of chronic, and they were now in the workplace as a person with a disability and an injured worker. So there was a lot of stigma in their return to work stories. So here's an example from one participant where she describes her return to work and really this negative treatment by her coworkers and her supervisor when she was returned to work, and how awful that made her experience. Everyone thought I was being treated special. So a lot of the participants described how difficult their return to work was now that they were sort of labeled as a person with a disability and an injured worker. So those were our main findings, and I'd like to spend the rest of the time really talking about what they mean. And I want to acknowledge that this was a small study in Ontario, and we really sought out sort of those difficult return to work trajectories. Like, we wanted to speak to people who had difficult return to work stories. And this isn't the majority of the people, but we think that this highlights an issue that has really been underexplored. In the cases where there's these complex return to work trajectories, the implications on people's lives are really broad, and our findings really showcase the pervasive suffering and persistent suffering that individuals are experiencing, even many, many years since their injuries, and the impact it's had on their lives. And knowing that workers' compensation policy has changed over time, we weren't able to tease that out in our findings. What was clear is that there was these themes of vulnerabilities and broad implications on people's lives. What we could conclude is that social vulnerabilities can accumulate and really cause suffering. And So somebody might be, there seemed to be the injury sort of pushed people over the edge, but they had vulnerabilities beforehand, and perhaps risk factors. Where people end up is really important for us to think about. These were people who reported a workplace injury, and many of them were ending up on social assistance. Because it was in Ontario, it was our general welfare program, which is Ontario Works. Some of the people were able to get onto ODSP, which is our disability support program, which has allows for significantly more money. I think 60% more income support per month. Either way, people were going from sort of the workers' compensation system towards the social assistance system. And as a result, there are pretty important concerns about poverty and mental health problems following a workplace injury and sort of into the long term. And I've already mentioned that these impacts really do seem to persist over time. So I will say that there has been other research that has begun to look at this and has begun to sort of follow people and start to sort of see that mental health and poverty are really important things that seem to follow some injured workers over time. So we need to look at this subpopulation. It's a minority of the workers' compensation cases, but for this group of people, there's some really significant implications. You know, we need to think about what it means to find people suitable work, and what happens when people are deemed ready to go back to work but yet can't work and have been told by their medical professionals that they need to do certain things before they can go back to work. And I think the other thing is, because we did capture some incidences of people successfully returning to work only to be terminated, I think there's an important need to follow up and examine what happens to people even when they do successfully return to work following a workplace injury. And so those are really important research questions to be asking. And then in terms of what could happen, what are some potential strategies? Clearly, there's a need for workers' compensation systems to consider the complexities in cases. And we feel, and we've since sort of joined forces with some of the injured workers groups in Ontario to try to look at where are the opportunities to track return to work outcomes and follow people long term. Because right now, workers' compensation sort of stops collecting data once people have returned to work and their cases are closed. And there's not good tracking elsewhere. In terms of social assistance, they really only track when people are currently receiving WSIB or workers' compensation benefits. They don't really ask questions about whether the individual was in the past an injured worker or experienced a workplace injury. And then I think there's also some opportunity here to look at how workplaces can accommodate diverse needs, including the needs of people who are returning to work following really any kind of injury, and what kind of workplace supports and accommodations are reasonable and available to employers. Because once people return to work, there was ongoing challenges that people experienced. So since this research, or actually around the same time, but a little bit after this research came out, a group of legal advocates and injured worker advocates in Ontario published a report called Where Do They Go? And really highlighted the need to examine what happens to injured workers over time. The group of people who aren't returning to work successfully and staying at work. It's likely an underreported group of people because, as I said, somebody can successfully return to work and subsequently lose their job because of their workplace injury. We believe that there's quite a bit of implication for other income replacement programs in Canada. And this also relates to some of the work that John Stapleton has written about around the welfareization of income support in Canada. Really, when people are kicked off of WSIB or deemed ineligible for WSIB, where do they go? They sort of go down to the lowest denominator, which often is social assistance. And so as caseloads on workers' compensation become restricted, there is implications for the other publicly funded income support systems in Canada. So that really needs to perhaps be tracked a little bit more. It is likely a minority group. It's probably not a big group, but it's an important group to look at and understand and perhaps better support. Our findings highlight significant implications for families. And since this research has been done, we've had lots of meetings around really focusing on how to track this population. Again, where's the best place to track it? Is it within the social assistance systems as people are coming on board? Is it the workers' compensation boards that need to be tracking people over the long term? Or is it some other way? And I think there's opportunity in all these areas. Here in Ontario, WSIB has recently funded a project to look at long-term outcomes. And so that, and for them, the long-term outcomes is 2 years from the closing of a case. So, you know, that's certainly a start in the right direction of what needs to happen. Since this research came out, we had a policy research action forum where we brought together researchers and WSIB representatives and social assistance directors in government to talk about this issue. And I think we were making some progress around how it could be tracked, and then we had a government change, and I'm not sure it's currently on anybody's radar anymore. But we really do need a plan to track where people end up and to get a better grasp of the scope of the problem. In Ontario, a number of years ago, the social assistance administrative data was made available to researchers, and you know, there was some hope that we could look at some of these issues. However, much of the data, many of the variables were unreliable, and certainly the issue of are you an injured worker is unreliable. It's tracked, but it's unreliable, and it's only really tracked when someone's currently receiving benefits. And then really an important to look at how this is happening in other Canadian provinces. So doing a comparative analysis across Canada, and certainly a need to identify vulnerabilities, looking at what puts a worker at higher risk of experiencing this complex return to work. And we certainly have some ideas of what leads to that complexity, but we need to examine that a little bit further. So certainly everyone needs to understand their role and certainly respect that role. There is currently some issues around the role of recommendations from healthcare providers in Ontario. I think there's a need to support workers who are injured as they're submitting claims, but also during that return to work process to really ensure that that return to work process is successful. We know that unsuccessful return to work processes are really devastating for everybody involved. So it's really important to put a lot of effort into making these success. And I think there's a need to really acknowledge that vulnerabilities, that people are complex, and that the many things outside of work impact people as they return to work. So it's important to support people who have these other vulnerabilities, whether it's poverty or being new to Canada, or having English or French as a second language. Are really important to realize that these are groups that tend to have a more difficult trajectory in their work following a workplace injury. And I've already mentioned this need to track. So before I say thank you and move on to questions, I will say that we have recently submitted a grant to examine sort of long-term outcomes of injured workers, and we would be looking at not only tracking the complex ones, but really tracking the successful ones as well. And I think it's easy to, in this study, we really focused on those people who were struggling, and so it really paints a negative picture. I think it's important for us to also look at those who are successful and who are able to return to work following a workplace injury in a successful way, and continue on in their career trajectory in a positive way. So we can start to identify what seems to be the key ingredients of success. So flipping around that this was a fairly negative picture of workers' compensation, I think that was the goal of this study. But going forward on a larger scale, we're hoping to get some funding to, and this is a study I've submitted. It's going to be led hopefully when it's funded by Vicki Kreisman in Laurentian University, where we do mixed methods and track people longitudinally using both quantitative and longitudinal qualitative investigation to really identify what are the things that seem to differentiate those who have successful return to works and those who have more complex return to work trajectories. So that's really what I see as the important next step, and certainly doing more tracking of people as they come onto social assistance programs.
That's excellent, Rebecca. Thank you so much. And as always, I've learned so much from you. I'm going to flip it over to read some of the questions now, but I did want to say that a couple of things that you said to me that you talked about today really struck, especially when you're talking about the intersectionality of complex situations that are preventing the return to work, and I think that is something that is it's very interesting to have research behind that. So I'm going to flip it over to the questions now. So the first question is, what do you think is lacking in research to help make progress in this area?
That's a great question, and I would say the number one thing is we've probably spent the last year or so really looking to see if there was administrative data or even StatsCan data to investigate the problem. I don't think this is well tracked by anybody, so we lack data, and we can look at WSIB data or workers' compensation data across the board, but they end at the time that the claim is closed. and so we don't really, so I guess we can turn to social assistance data. You know, this isn't well tracked there. So the barrier has been gathering data, and so if we're able to get some funding, we will actually collect our own data. But when you're looking at looking at this issue at a population level and getting some understanding of the prevalence of the problem, how many people are affected by it, it's very, very difficult because there's just no data.
Yes, thank you. And even the beginning of your research, and you're talking about a small group, and that it's a great start, is an indicator of the lack of research. So thank you. So the other area is the next question is, which industries has your research been conducted in? And then I'm going to add on the next question, which is, of those industries, which do you find are more equipped for return to work than others?
Okay, I can answer the first question. The second question, I'm not I'll have to give it some thought, but the first question, our data was generally, I would say, manual labor. It was heavy in the manual labor. So factory was heavily. Most of the participants came from sort of a factory setting. Who's better equipped? Which industries are better equipped? I'm not sure I can answer that question. But I will say that I think in many ways it comes back to the vulnerabilities that workers have before they're injured. So workers, and this is a hypothesis, this is not based on the research, but I think workers who are best able to navigate the workers' compensation system and the rehab process and the return to work process are probably workers who have different skill sets so that they can work in different jobs. So if you're injured, but you're in a low level laborer, you might have fewer options than someone who has skills that are transferable. So I suspect that it comes back to those multiple vulnerabilities that people come into with. But that is one of the reasons why we need to, I'm hoping that Vicky's study is funded so that we can really look at workers from the point of injury onwards to sort of see if we can identify who's most vulnerable and who's most set up for success.
Right. Okay. So along those lines, maybe this is a very broad question, but maybe you can, there's an example off the top of your head. Are there any best practices that you are aware of that support injured workers?
So I'd have to think about the literature more broadly than what we looked at in our study, but I think, and I'm going a bit off the top of my head here, but I have read the literature. I'm not going to be able to list sort of the top 8 right now, but I think the literature really highlights the need for communication, and by communication, it's not just between the worker and the workplace and the Workers' Compensation Board, but including healthcare providers. And I think there's a real need to ensure that recommendations from healthcare providers are valued.
Right.
And that's been, as I said, I'm only familiar with the situation in Ontario, but that's been highlighted by some of the legal experts in this area as being a real concern at the moment, that healthcare providers are making recommendations and their recommendations seem to have little impact on the decisions being made in terms of return to work.
Right. that kind of
Yes.
wraparound service, right? Like the individualized services,
Yeah.
as opposed to just like an off-the-shelf kind of solution.
Yeah, and I think that came up in our findings too, this idea that, you know, a broken leg means X, Y, and Z, rather than, oh, you have a broken leg and that resulted in these other injuries. We need to look at you holistically as we make decisions around your return to work.
Right.
So it's definitely a wraparound. It's definitely also likely a need to have support for employers who are who then need to think of how to accommodate the worker in the workplace, and what does that mean, and what can helping employers think through what can this person do in the workplace now that they have, you know, some restrictions and limitations, and helping sort of skilling up employers in terms of their capacity, and to borrow from the Disability and Work in Canada strategy, their confidence in being able to work with diverse workers, including those with disabilities.
Yeah, exactly. Perfect. Thank you. So we have 3 more questions. The next one is, it seems that subpopulations are very important. Do you have some suggestions on how to get a significant sample on a subpopulation basis?
So I think yeah, I agree that subpopulations are really important, and you know we know in when it comes to sort of health and social services, it's often a small group of people that are using a lot of the services and causing having the most challenges. So I think we can kind of all agree that subpopulations are still important. I think with our with the study we were just proposing at the moment, we need to, the only way to get a sufficient sample size is really to partner with community organizations, including the workers' compensation board. So we need to make sure, I think in the past, some workers' compensation boards have feared research and worried, but we need to really form positive relationships with workers' compensation boards and work with the workers' compensation boards to recruit. I think there's often opportunity also on the other end with social assistance programs to also find samples there. So I think recruitment to get a sufficient sample size really needs to be multi-pronged. But I would say the most critical partner in this has to be the workers' compensation boards. Okay. And working with them and helping them perhaps see this work as not, this is important work, because we're not just we're going to identify who needs the most support, but also what makes it successful, and not sort of seeing this kind of research in an adversarial way.
Right, exactly. We're all in this together.
Yeah.
So the next question starts with kudos. So congratulations on the follow-up with key stakeholders on discussing results with decision makers. Do you think that beyond research funding, that WSIB would consider policy changes, and what could those policy changes look like?
So I do think WSIB would consider policy changes, and it's 100% because in Ontario anyways, because of the work of the advocates who have continued to build relationships with the WSIB. So some of my collaborators and partners and people who I work with a lot from legal aid communities and from the injured worker community have regular meetings with WSIB and continue to have those meetings. And I think at times it feels like, it's not moving forward, but I don't think they'd be taking the time to have those meetings if they weren't willing to think about moving forward. And it will take time. But I do think the fact that they funded a project this last year looking at long-term outcomes, meaning 2 years post claim closure, is a really positive step and is really showing that they actually do want to know what happens to injured workers.
Right.
So I do think they will. What will those policy changes be? You know, I'm not sure. I'm not sure I'm the best person to answer those questions. I think certainly we need to look more than just at whether someone returns to work, but we need to do some sort of follow-up. I think the question becomes, how far out do we go, and whose responsibility is it? You know, at a certain point, when does the workplace injury end and WSIB's responsibility end, and it become a larger social problem? I'm not sure I know the answer to that. I know I don't know the answer to that. All I know is that it's something we need to grapple with a bit.
Yeah, it's a very, very good point. And I think that even in the recruitment and onboarding process of people with disabilities prior, not even just returning to work, but entering the workforce, I think that it's the same type of consideration. When do they become quote unquote workers, and when do they become quote unquote, you know, statistics that we can actually track and count? So that's very interesting. So this is the last question, and maybe you can just ponder this for a second. It was a good question. It was the first one, but I thought we'd hold it to the end. If you have one message, Rebecca, to our attendees today, what would that be? One thing that you would want to make sure that they remember as they leave today's webinar?
I think for me, and this is, since this research has occurred, I've done more and more thinking about sort of what lands people in social assistance, and that there's always a complex story that brings people to that place. And I think we probably need to change the way we think about social assistance and our social safety net. You know, as an example, last week I was collecting data in a homeless shelter, and on a completely different study. And one of the participants living in a shelter told me that this all started a year ago when he was injured at work, right? So, you know, people don't choose to end up in a homeless shelter. People don't choose to apply for social assistance, but something led them there. And we probably need to change that mentality of how what we're doing to support people who have somehow ended up in that place.
It's an excellent point, Rebecca, and it's a great thing to leave this this webinar with, because I often remember our colleague Steve Mantis from the Injured Workers Group, and he has said a stat that is unproven. I don't know, but I believe Steve, and that is that 50% of the people in Toronto that are homeless are injured workers. And so we have to recognize that we have to do a better job. So so I thank you so much for your time, Rebecca. You have been absolutely wonderful as always, and I look forward to continuing our work together. And I'm sure that the attendees on the call are going to be taking back lots and lots of information, but also some thought-provoking discussions for colleagues moving forward. So I thank you very much.
Thank you so much, Rebecca, for shedding some light on the experiences of injured workers who do not successfully return to work after a workplace injury, and also for sharing your research and expertise on the subject. We're leaving with a lot of knowledge, so thank you immensely for this compelling webinar. And Maureen, thank you so much for making the time to moderate the webinar. As always, you've been fantastic. It's a true pleasure to have you both online today. So finally, thank you to our audience.